Good afternoon and welcome to a special edition of Eye on Northeast Kansas. September is Suicide Awareness and Prevention Month. As part of our Hear Me, See Me mental health initiative, we want to give you the tools to support your loved ones and yourself. This is a tough topic today, so as we go through our discussion, if you recognize yourself or a loved one struggling, know that the 988 Suicide and Crisis Lifeline is there for you 24/7. And in fact, we're going to focus on it a little bit later in the show. Suicide is a concern across the age spectrum, and we begin our discussion today with a look at how we might see signs or handle discussions differently in young people versus adults. Karen Smothers is Chief Clinical Officer at Topeka's Family Service and Guidance Center, and Ariel Ludwig is the Outpatient Services Manager at Vallejo Behavioral Health. Thank you both for being here and getting things started today. Appreciate it.
It's a pleasure.
Thank you.
So I think sometimes when we talk about young people, Karen, the question always is, are they just tiny little adults, or what do we need to keep in mind when it comes to young people?
Yeah, absolutely. So with young children, especially when we talk about something as serious as suicide, I think it's important to have conversations with our children and keep that dialogue open as to when they're experiencing big feelings. And of course, how you would address that with a younger child versus an adolescent might look different depending on their developmental stage. So with younger children, it's really important that we keep dialogue open when they're saying big words or they're very frustrated and maybe they say something about wanting to kill themselves. And so asking a little bit more about what's going on, what are you feeling, and having a very non-judgmental, gentle approach to keep that communication going to offer support to children. And then the same with adolescents. If we see things change in their behavior in terms of their sleep or appetite, maybe they're isolating themselves, those are definitely key things to look for.
Is that going to be the same with an adult?
A lot of what Karen said will be the same. The listening, validation, I like to use the 3 C's, care, connect, and collaborate when you're speaking to anybody with suicidality. Adults tend to have their own independence and autonomy, and a lot of times we rely on others to help us help them. I do want to pitch actually that, Vallejo offers a QRP, which is question, or QPR, which is question, persuade, and response, or referral, sorry, my apologies. It is a program that we offer for free, and you just sign up through the website. There's also the mental health first aid, which helps us identify crisis. Whenever you're speaking with adults, there's co-occurrent issues. If I was to put them in kind of a formatted level, I would say that we look for factors, we look for individual factors, finances, housing. Those are big things. We will look at relationship factors. Are they lonely? Are they isolated? Do they have social capital, meaning do they have other people in their world right now that can provide care to them? And then we look at community. What do we see from disenfranchised people? What cultural groups? Are there people that are able to talk to them that look like them? Stuff like that. And then societal issues. Those are the public announcement. Is there any announcement saying that suicidality is a real thing and it's okay to seek help? Is there hotlines available, and those kind of items? I think in totality they'll be very similar, but with the independence that adults have, they do have choices of their own. And if they do have more what we call acute issues, sometimes it's harder to find.
In both cases, is it the communication piece that's so key?
Absolutely.
Absolutely. Becoming, an adult can struggle with substance use, and there's SAMHSA put out the latest research, I think in like 2022, and 1 out of 3 suicide attempts were related to alcohol use or excessive use. And so there's a lot of combinations of things, and when things become legal, like substance use, we have a combination of issues that can actually increase. So there's
so there are those combos in adults.
Mm-hmm.
Kids maybe not quite as much, but same thing. Who do you call first?
So in terms of communication, I think it's really important that we all learn to be able to ask the question, are you having thoughts of suicide?
And that's okay with a child as well?
With a child, like we were saying earlier, a child, developmentally, we need to adjust our approach. So sometimes it's just noticing things are really bothering you. I'm here to talk. Come talk to me when you're ready, and opening up that dialogue.
Well, it's good to have the dialogue here to start as
Sure.
well. Karen, Ariel, appreciate you both for getting the conversation
Thank you.
started. And they've already hinted at there sometimes are other factors, life experiences that bring extra concern for mental health. We'll look at some of that for veterans and those issues surrounding substance use next.